Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? They told him, "Go home, it's nothing to you." When he came to me, we barely saved him. He had a ruptured appendix. Patient getting anxious about numbness in his hand. It's getting more frequent, and I don't want to live like this. It gets me freaked out like my hand's not there. They assumed the person was suicidal and having symptoms of panic attack, elevated breathing rate, tingling/numbness in hands. They did a court because I requested it. There was a lesion. They blew it off. MRI showed it was glioblastoma multiforme. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off, and told not to worry about it. Derm even burned off a nodule that was bothering him at his belt line, but repeatedly said it was nothing, and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist since our experience was so negative. Next derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, tridge and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so fucking patronizing with our concerns and shove his face deeply into his own ass. Obligatory, not a doctor. I'm working as a carer while I study nursing. Discovered a 90-plus-year-old woman had a broken hip that the nurse who assessed her after a fall completely missed. Most elderly people who break a hip will die within a year. Fast treatment is crucial, and it's a pretty fucking big thing to have missed. Not a doctor, but I've been dealing with abdominal pain since a child. Countless ultrasounds, doctor appointments, visits. I was always told it was in my head. Recently had surgery for something and related during the surgery the had to free my appendix that was stuck to my abdomen wall, and just the tip is healthy at this point. I've been suffering for years with a mild case of appendicitis and my body was pretty much just absorbing my appendix. I will have to go back to get it removed at a later surgery because it was so stuck all they could do was free it, and they didn't want to risk it at that point because it was going to cause more pain. So that was cool to find out. I'm a dentist in the UK. While I was working as a locum in an emergency clinic, had a man present with a mouth of infections. He had wanted implants, went to a private UK dentist who refused to do them due to the patient's heavy smoking and poor oral hygiene, which would mean the chance of success and good healing would be limited. The patient didn't accept this, went online and found he could go to Hungary and get the implants done for half the price and have a holiday. Came back and within a few weeks most of the implants are infected and has sat in my chair. We gave him antibiotics to clear up the infection, but then had to inform him that the implants would need to come out and he would need to find a specialist dentist with the necessary equipment to get that done. He was not happy. Spent all that money only to have to pay again to have them all removed. No better off and at least 10G down. Should have listened when the first person told him no. Not a doctor. While working as a CNA on an ICU step down unit, I noticed my patient was acting strange. Asked her a few questions, got some questionable answers. Thought it might be weird, as she couldn't really answer questions other than huh and aha. Her gait was weird, like a trot, rather than a normal walk, plus she was leaning. I was training another CNA, and I was like, no matter what you do, if you see something, notify the nurse and chart that you notified her. The patient was having a major stroke and the nurse was too far up her own ass and her own phone to do an assessment. The woman had to go to rehab and was not a candidate for any stroke reversing drips as I had charted that she seemed off 8 hours before. The only reason anyone caught it was because the night shift nurse insisted on bedside report. The nurse I had been working with yelled at me stroke. Like I hadn't been notifying her of symptoms all day. I'm the patient in this story, but I still think it's worth saying. I started having horrible ankle pain when I would walk in grade school, and my doctor always attributed it to growing pains. I knew that was bullshit, and so I kept annoying him about it. After multiple attempts at diagnosis, everything from knock knees to pigeon toe to just being weak, I finally went to a specialist. He asks me to flex my ankle, and so I do. No, all the way he said, even though I was flexing as hard as I could only flex my foot maybe an inch from its resting position. Turns out, I had incredibly decreased mobility of that joint due to shortened tendons. He diagnosed me within 5 minutes, after years of my doctors brushing me off. After a few months of physiotherapy and a shoe insert, my pain decreased by a lot. Not a doctor, but actually the patient. I had a doctor prescribe me birth control. While in line to pay for it, I'm reading the paperwork that comes with it, and learn that another medication I'm on, permanently and every day, completely voids out any effect the BC would have. I went back to the pharmacist and asked about interactions, and he says I may have side effects. I ask which ones, and he says, pregnancy. Pregnancy is not a side effect. It is a lifelong commitment. Then I call the doctor and ask why they would prescribe something they knew wouldn't work, and she said, butyl. I asked for BC. Like, yeah I did, but I wanted some that would work. Silly me for not specifying that. Broken neck. No really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray we see that it was there prior to the operation. After questioning the patient he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately he passed away about 2 weeks later due to the cancer. Not a doctor, but the patient. And it's nothing major. I have anxiety that can get pretty bad when untreated. I went to see my general doctor about it and tried to explain my symptoms. She told me it was heartburn. I tried to explain that I thought it might be anxiety and she yelled at me. She got upset and told me how everyone is stressed and how these are stressful times. It's normal. I was having heart attack symptoms and I'm far too young with no heart problems to be having a heart attack. I went to a new doctor and before I could even finish explaining she cut me off and said, yeah, you've got anxiety. I was out on meds and within the week I was feeling better. As a patient, my eyes were hurting, and I kept going back to my eye doctor, who insisted that the problem was that I wasn't cleaning my contacts properly and just kept giving me harsher and harsher chemicals. It got to the point where I couldn't open my eyes fully in a room with the lights on, and I hadn't worn contacts for months. Finally, after a year, my mom forced my dad to take me to a different doctor. Literally he met me in the waiting room, looked at me with his naked eye, and said, you have a raging eye infection. A month of antibiotics and the infection was gone, but there was so much scarring and damage it was 20 years before I could wear contacts again. Yet another, not a doctor, but my grandmother had a lump on her tongue, and when she went to the doctors the person who examined her said it looked benign, but didn't feel comfortable so said she should go to an expert, lest it become malignant. A more senior doctor decided against that, and blocked the proposition. A couple months later it is malignant, and she needs half her tongue cut out plus tonsils. Another, not a doctor, but my mill had all the signs of stroke, severe headache, vomiting, vertigo, vision problems, partial paralysis, but was sent home from the ER and told it was an in-arrear condition that would resolve on its own. When it did not get better she saw her GP, who upon merely looking at her asked when she had had a stroke. When he realized it was still untreated, he immediately sent her back to the hospital. There they finally recognized that she had had a major stroke. She could easily have died and was in rehab for weeks. They then claimed that it must have happened after she was there the first time because, and this is really unbelievable, her chart from that visit did not say that she had had a stroke. So much wrong with that statement that I don't even know where to begin. Not a doctor but the patient. I was given someone else's medicine while in the hospital, via and forth. The nurse realized, after I had finished the bag, that she screwed up. Then hid the bag in the garbage. The night nurse brought it to my attention, because he was confused that someone else's used fourth bag was in my private room. I was on a severe liquid restriction at the time too, so there was an extra couple 100 milliliters of fluid that I should have not had. A few other things that happened during that time in the hospital. Left in my own feces while in a coma for hours that resulted in it eating away and breaking down my tissue on my coccyx. Was restrained and severely burned as a result. They didn't use the pads like they're supposed to or ask family. Skin blackened. Almost lost my hand. Oh, I should explain I was restrained because I was coming in and out of the coma, tried to scratch an itch and accidentally pulled out my nose feeding tube. My PICC line was pulled almost completely out and was given a lot of potassium. Now, if it's pure potassium it will burn. Since I was on a fluid restriction it couldn't be mixed with saline. My arm would swell, burn red. It was so painful. It took about a week before someone realized, well, this doesn't look right. Booking agent screwed up on an appointment, so I ended up getting a vital checkup and blood work when my cardiologist and the infectious disease specialist weren't on site. Blood work was drawn wrong and no one thought to double check. Was not told my true results from another blood test which lead to me almost dying 1 week later. During a debridement they didn't realize I was coming in and out of my coma, so I felt everything being cut off and removed, but couldn't say or do anything. Not a doctor, but a friend of my mom's went to an ophthalmologist for an eye problem. During his exam, he asked her, so how long have you had manuscript? That was the first she was diagnosed. She had been battling various manuscript symptoms for a couple of decades without a diagnosis. I suppose I have one for this as a resident doctor. We saw a kid in the morgue for difficulty walking. He had been slowly losing the ability to walk over months and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip, then the other hip, gave some Zofran etc. Turns out on exam he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me, and I'm not even good at this yet. Did a cord scan. Big ass tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. Thanks for watching and share your stories. Don't forget to consider the idea to maybe think about potentially subscribing. Peace.